Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 50 of our series, Future Focus, Envisioning a World Without Sickle Cell. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us build a community of hope and determination as we look towards a future free from sickle cell disease. Can you imagine a world without sickle cell disease? A world where millions of lives are free from the pain and suffering this disease brings? Welcome to part 50 of our series, Future Focus, Envisioning a World Without Sickle Cell. Today we're embarking on a journey of hope, innovation, and transformation as we envision a future where sickle cell disease is a chapter in history books rather than a harsh reality. In this exploration, we'll delve into 5 key areas that hold the promise of turning this dream into reality. First, we have gene therapy and editing, an exciting field that aims to rewrite the genetic code that causes sickle cell disease. However, it's still in the experimental phase with unknown long-term effects and potentially high costs. Next, we have universal newborn screening and early intervention. This approach aims to identify and treat sickle cell disease from birth, allowing for early management and potentially preventing complications. But it does require substantial healthcare infrastructure and raises ethical considerations. Our third area is global access to existing treatments. By ensuring worldwide availability of effective treatments, we can improve the quality of life for individuals with sickle cell disease globally and reduce health disparities. Nonetheless, logistical challenges and economic barriers stand in the way. The fourth area is advanced stem cell transplantation. This method has proven potential for a cure and is becoming safer and more accessible, but it still carries risks and requires a donor match. Lastly, we have preventive genetic counseling. This strategy empowers informed family planning and could reduce the incidence of sickle cell disease. However, it also brings up ethical concerns and the potential for discrimination. Each of these areas presents its own set of possibilities and challenges, but together, they illuminate the path towards a future free of sickle cell disease. A future that once seemed distant but now is within our reach. Join us as we explore these 5 pathways that could lead us to a world without sickle cell. First, let's explore the promising field of gene therapy and editing. This cutting-edge area of medicine is about using advanced genetic techniques to correct the sickle cell mutation right at its root. Think of it as editing a typo in a Word document, only this time, the document is the human genome, and the typo is the sickle cell mutation. The potential here is enormous. If successful, gene therapy could provide a permanent cure for sickle cell disease. It addresses the problem at its source, so it's not just about managing symptoms or preventing complications, it's about eradicating the disease entirely. That's a huge game changer. However, as promising as it sounds, gene therapy and editing are still in the experimental stages. We don't yet know the long-term effects of these techniques, and there are valid concerns about potential side effects. Also, the process is complex and requires a high level of expertise, which could translate into a high cost for the treatment. But let's not lose sight of the hope this field brings. In 2019, a woman in the US became the first person to be potentially cured of sickle cell disease using CRISPR gene editing technology. This groundbreaking case showed that it is possible to correct the sickle cell mutation, and in doing so, potentially cure the disease. This is just one example of the progress being made in gene therapy and editing. There's a lot more research underway and the future looks bright. We're talking about a world where sickle cell disease could be a thing of the past, and that's a world worth fighting for. While still experimental, gene therapy and editing hold promise for a permanent cure. As we continue to refine these techniques and understand their implications, we move one step closer to that goal. The journey may be long, but the destination is in sight. Next, we delve into the approach of universal newborn screening and early intervention. Imagine a world where, from the very first breath a child takes, we already have the knowledge to provide them with the best possible start in life. This is the world that universal newborn screening and early intervention seeks to create. This approach focuses on identifying and treating sickle cell disease right from birth, giving us the opportunity to manage the condition from the earliest possible moment. But why is this approach so important? Well, sickle cell disease can lead to a myriad of health complications if left untreated, from painful crises to life-threatening infections. By identifying the disease at birth, we can initiate early interventions and possibly prevent these complications from even arising. However, like all great endeavors, this approach is not without its challenges. Implementing comprehensive screening programs requires significant healthcare infrastructure, which may not be readily available in all parts of the world. Also, there are ethical considerations to ponder. For instance, how do we ensure that the privacy and rights of the newborns and their parents are respected? Despite these challenges, there are inspiring examples of this approach being implemented successfully. Let's take a look at the country of Oman. They implemented a comprehensive national program that combined newborn screening with early intervention and genetic counseling. The result? A significant reduction in sickle cell incidence. This is a powerful testament to the potential of universal newborn screening and early intervention in the fight against sickle cell disease. It's clear that this approach holds great promise. By catching sickle cell disease at birth, we can potentially change the course of a child's life. But to make this vision a reality, we need to invest in healthcare infrastructure and address the ethical considerations involved. With significant healthcare infrastructure, this method could potentially prevent complications from the onset. Now let's discuss global access to existing treatments. This is a critical aspect of our journey towards a world without sickle cell disease. The treatments we have today, while not perfect, can significantly improve the quality of life for many patients. However, these treatments must be widely available to all patients, regardless of where they live. This is where global access comes into play. Global access to existing treatments means ensuring that every person with sickle cell disease, whether they are in New York or Nairobi, has equal opportunity to receive the care they need. This can be life-changing. Many of the complications and fatalities associated with sickle cell disease are not due to the disease itself, but to a lack of access to necessary treatments. However, achieving this is not without challenges. The logistics of delivering medications and healthcare to all corners of the globe is a monumental task. There are also economic barriers to consider. Many of the countries with high rates of sickle cell disease are low to middle-income countries, where the cost of these treatments can be prohibitive. But let's not forget about the potential benefits. Global access to treatments can reduce health disparities and improve the quality of life for millions of people. It can also help to reduce the global burden of sickle cell disease, as well-treated patients are less likely to require hospitalization or suffer from severe complications. There are already some promising developments in this area. For instance, in 2019, the FDA approved two groundbreaking drugs, Adakveo and Oxbrita. These drugs address the root causes of sickle cell complications, offering hope for improved quality of life for many patients. However, the challenge remains to make these and other effective treatments accessible to all who need them. This is a complex issue, and there is no easy solution. It will require cooperation and commitment from governments, healthcare providers, and the pharmaceutical industry. But the potential benefits are enormous. Improving global access to existing treatments can significantly improve the quality of life for patients. And that's what our journey towards a world without sickle cell is all about. Lastly, we shall look at advanced stem cell transplantation and preventive genetic counseling. Advanced stem cell transplantation is a promising frontier in the fight against sickle cell disease. This process involves replacing a patient's diseased blood cells with healthy ones from a donor. It's a complex procedure that, while potentially curative, comes with its own set of challenges. The procedure requires a donor match, which isn't always available, and despite improvements in safety, it still carries certain risks. However, as this field advances, we see more and more success stories. For instance, the National Institutes of Health have developed a modified stem cell transplant technique that doesn't require chemotherapy, making the treatment safer and more accessible. On the other hand, preventive genetic counseling is a proactive approach that focuses on education and informed decision-making. It involves educating individuals and families about the sickle cell trait, inheritance patterns, and the implications of having a child with the disease. The goal is to empower people to make informed decisions about family planning. This method has seen great success in countries like Brazil, where widespread genetic counseling has led to a significant decrease in the birth prevalence of sickle cell disease in some regions. However, it comes with its own ethical considerations and potential for discrimination. In summary, both advanced stem cell transplantation and preventive genetic counseling have the potential to significantly reduce the global burden of sickle cell disease. Both approaches have their pros and cons, but with continued research, improvements in technology, and ethical guidelines in place, they hold great promise for the future. With continued innovation and global cooperation, these methods could bring us closer to a world without sickle cell disease. Before we conclude, I want to emphasize that the information provided in this video is for educational and entertainment purposes only. Any health-related decisions, especially regarding new treatments or clinical trials, should be discussed with a licensed physician familiar with your individual case. Thank you for joining us today at the Victory Education Lounge. If you found this information helpful, please like, share, and subscribe to our channel. Your support helps us continue providing valuable content and fostering hope in the sickle cell community. As we look to the future, let's carry forward the strength, resilience, and determination that have characterized the sickle cell community. Together, we can work towards a world free from sickle cell disease. Until next time, stay hopeful, stay engaged, and stay victorious.